Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned neonatologist from Mysuru, that is Dr. Deepthi Tandaveshwar. She did her MBBS from JSS Medical College and then did her MD Pediatrics from JJM Medical College, Davangere, and then she got her fellowship from the most prestigious Indira Gandhi Institute, and now she is a neonatologist and that too associate professor in JSS Medical College. She is a best teacher. She has got the best teacher award, and apart from that she has pursued her academic research work also, and she has got the best research paper award also. So congratulations, Dr. Deepthi. We are very happy to have you on our show. You know, you're a neonatologist. What is neonatology? Please tell us.
Thank you, madam, for this opportunity. Neonatology is that branch of medicine or pediatrics that mainly deals with problems of newborn babies, babies who are born, and from the day of birth till the first 28 days of life, any problem that the baby faces, the branch which deals with it is called as neonatology, and these babies are cared for in a special intensive care unit called as the neonatal intensive care unit.
That is NICU. Okay.
NICU.
Now you are expert in that. Which is the smallest baby that you have treated till now?
The smallest baby that we have treated till now is a 720-gram baby. Today we are discharging another baby from our NICU, which is 750 grams. Tomorrow there's one more baby who stayed with us for 2 months, and baby is growing home. This baby is also 750 grams, and baby is, by God's grace, doing well and happy to go home tomorrow.
God's grace as well as the effort of the pediatricians like you, neonatologists. It's a both. God helps those who help themselves. So you are helping the mothers and the children. That's a great
and
thing.
Neonatal care is a teamwork. It's a teamwork of nurses and doctors. Nurses play a very important role in our neonatal ICU.
Yeah, exactly. Very true. And in fact, any medical profession, if you want to, like pediatric cardiology, mine is also a teamwork, We may be captains, but all the players, they play a major role. Now, tell me, what are the causes for this prematurity, and when do you call low birth, and what are the classifications?
Prematurity is mainly babies who are born before 37 weeks of pregnancy. Normally, normal delivery, usually we say once the baby is born after 37, any baby born before 37 is called as a preterm baby. So in preterm, again, you have 3 categories. One is the low birth weight, very low birth weight, and extremely low birth weight. On an average, Indian babies are more than 2.5 kgs. Any baby which is between 0.5 to 1.5 kg is called as a low birth weight. Between 1 kg to 1500 is called as a very low birth weight baby, and any baby less than 1 kg is called as an extremely low birth weight baby. There are many causes for a baby to be born premature. There are maternal causes, and causes because of the mother's condition, some because of the uterus or the placental problems, and some could be because of the baby's condition itself. So if the mother is of a very young age, that is teenage pregnancies, or if the gap between 2 pregnancies is very less, there is high chance of her having a preterm delivery. If the mother is having hypertension, that is increased blood pressure during pregnancy-induced hypertension that we say, or if she's having some infection, that is chorioamnitis, or if her water starts leaking, that is called as premature rupture of membranes, then there's an increased risk of the baby also having infection and her going for a preterm delivery. Sometimes the placental causes, that means placenta previa, abruptio placenta, can also cause preterm delivery. Of late, we are seeing a lot of mothers who are conceiving through in vitro fertilization, IVF treatment. They end up having twin pregnancies, triplets. They are also at high risk of delivering prematurely.
So they pray and struggle for one baby, and they get 2 free, and one more is free, buy one, take one free, like that.
It's like a bumper lottery.
One baby bumper lottery, double.
Yes.
And when they're too small, problems and how do you tackle them?
Yeah, there are many problems that these babies face almost every day, but the commonest ones are immediately after the baby is born because all the organs are immature. They have not developed completely. They face problems like in the lungs are not completely inflated. They should be inflated like a balloon for the air to move and the baby to breathe
Yeah,
easily.
yeah,
But
very
but here what happens, the lungs are collapsed. So there is not
collapsed.
much air that the baby is able to breathe in and breathe
Breathe
out.
in,
So they
breathe
have
out,
a lot of problem immediately after birth with breathing.
breathing.
Secondly, if you go, these babies, normally all the babies which are born, they have a hole in the heart that is called as a patent ductus arteriosus.
Okay. Yeah,
This normally
that is
close.
an actually it's a normal channel which is required
Yes,
in the fetus that is now in the mother's womb. But the moment the child is born and it cries, the lungs expand and this channel closes. But here in this preterm baby, because they don't cry, because the breathing is not enough, oxygen is not there, so this will not close. Okay,
this will
then
not close.
yeah,
And
yeah.
then once we start feeding these babies, because the intestines are not mature enough, these babies cannot digest the milk. And they are
Okay.
at a high risk of having infections. They
Hmm.
also go for hypothermia. That means the
Temperature
whole
goes
body
down,
becomes very cold because
cold.
they cannot generate heat and keep themselves warm. They can also
And
have
that is
bleeding
very,
in,
very dangerous, because if the
yeah,
temperature goes and anytime we can lose the child. So that's
baby,
also very
yeah,
dangerous. Yes.
yeah.
Mm.
And they can also have bleeding in the brain that we call as intraventricular hemorrhage because the blood vessels
That's
are
the,
very
yeah,
thin and very
yeah,
delicate in these
very
babies.
dreadful.
So
Yeah.
these are some of the common problems that we face in the initial few days.
Mm-hmm. Yeah. So the brain can be damaged, the heart can be damaged, the lungs are not working, the intestines are not working. Probably sometimes the kidneys also will not be mature.
Kidneys
So
are
that, yeah,
immature, yeah.
they're also immature. So almost all
Yes,
the organs are immature. So until it matures, we should protect. Now, how do you
yes.
protect and how do you take care of the baby?
Uh, Babies which are born prematurely need special care. They are very delicate, so they need special care. They need to be nursed in the NICU. We have
Mhm.
specially trained nurses and doctors who take care of them in the incubators and the warmers. And now medical science has advanced to such a stage where we are able to survive most of these babies. There's a very famous story about the child of the famous American president John F. Kennedy. His wife, Jennifer Kennedy, she delivered a premature baby in the 1970s. And such an advanced country like America could not help to make this baby survive. But now, over the last 20 decades, we have advanced to such a stage
Yeah.
where almost 95% of these babies go home safely.
Yeah.
So
And
these babies,
that's the reason when John F. Kennedy, he spoke in the UNICEF. In his speech, he tells the children may be the victim of their fate, but let them not be victim of our neglect. See,
yes,
by some fate, they are born premature or they have some problem, but we should not neglect. I think the negligence has come down, and in fact, the care has become much more now. And I think
yes,
not only America, even in India, we are on par with the any best center in the world, and that's the reason we are able to save them. In fact, the PDA which was there in the preterm babies, we were not able to close. Now, even 800, 700, 600, milligram, babies, we do
gram
the
babies.
closure. Yeah, we have a special device we call Piccolo, and that can be closed, so that the baby can
Yes.
gain weight. Yeah, please go ahead.
Yeah, we are nowhere behind the Western countries. We are on
Correct.
par with
I
them,
agree.
madam, as you have told.
Yes.
So initially, after they're born, we admit them in the ICU. If they have breathing problem, we provide some respiratory support to help them breathe. We give what is called as a CPAP, continuous positive airway pressure. Or if the disease is very severe, we may have to put the baby on ventilator for 2 to 3 days.
Ventilator. Yeah. Yeah.
Gradually, we start giving feeds through the tube, which goes to the stomach. And we, all of us who are taking care of these babies, we take utmost precaution to make sure that the baby doesn't develop any infection. That's why entry to the NICU is restricted. We allow parents for a very limited time, but the mother can do wonders to this baby. There is something called as the kangaroo mother care, where the baby, once the baby is stable, we advise the mothers to keep the baby in between her chest or skin to skin contact so that the baby remains warm. The baby gets mother's milk. There's a bonding between the mother and the baby, and these babies gain weight faster, they digest milk, so it has a lot of advantages. So this is one of the miracle therapy where mothers play a very important role in the treatment.
Now, what are the do's and the don'ts that you would like to tell the parents?
Yeah, once the baby's in the NICU, I agree. Being a mother, I know it is a very anxious moment for the parents. They're always worried, especially initial few days. What is happening to the baby? When will my baby come out? But first and foremost, they need to have trust in the doctors, trust in the nurses, because all of them would want to do the best for the baby.
And trust Almighty. Do your best and leave it to God. That is also important.
Yes.
Yeah.
And they need to have a lot of patience. And in our Indian custom, it is a ritual to go and visit the hospital. All the relatives want to come and visit the hospital. So one thing as a doctor, I will tell them, please don't come, especially if the baby is in the ICU. Entry is very restricted. This is for the best interest of the baby, the doctors. Yes, because we want to prevent infection. And whenever you're allowed inside, please hand wash thoroughly and only then hold the baby. And as much as possible, the mother
And
should
even the mask, wear the mask, because the
mask.
breath and the mouth, with that, the infection can spread. Okay.
Yes, mother needs to take proper precautions. She has to maintain personal hygiene. And as much as possible, we advise the mothers to give their own milk, mother's milk, because it has colostrum and very useful. And she should give kangaroo mother care. So these are few of the things that they should take care.
Yeah, very, very nice. Thank you very much, Dr. Deepti. So beautifully, so nicely you have explained to our viewers. And I'm sure anyone with the premature baby, they will not be afraid, but they will take care and also join hands with the neonatologist like you to save the precious life, So because they would have waited for 8 months and they should not lose the baby at the end of the 8 months. So thank you very much. And you are doing the great job and all the best.
Thank you, madam, for this wonderful opportunity. Thank you. Thank you very much.